Hi everybody, my name is Hope Jones and today I'll be presenting Abdomen Case Study 5. This patient came into the hospital. He was a 32-year-old male and he was complaining of shortness of breath or dyspnea and pain in his left shoulder when lying down. This pain eased when he stood. So, some more background information. This patient was in an ATV accident earlier that day. He fell off the vehicle very hard onto his left side. However, he felt no immediate pain or symptoms, so he continued his ride and continued on his day. He ate a meal and took a nap. However, upon waking up from this nap, he was suffering from dyspnea or shortness of breath and pain in his abdomen and the pain in the left shoulder that he complained of earlier. So, upon measuring his vitals, it was found that his blood pressure was a little on the low side. Normally, blood pressure is not a concern. However, his pulse was also a little on the high side. Again, neither of these measures on their own could be of particular concern. However, the combination of a low blood pressure and a high pulse could indicate internal bleeding. So, upon physical exam, his chest radiograph was normal. His abdominal CT scan revealed hemoperitoneum or blood in the peritoneum, very concerning. He was suffering from diffuse abdominal pain, which is widespread pain, very hard to pinpoint. Most abdominal pain feels this way. He also experienced pain and rebound tenderness in his left upper quadrant. Rebound tenderness is when the physician presses in into the abdomen, and upon release, the patient feels a lot of pain, far more than when the physician pressed in. Patient is also experiencing bilateral wheezing or trouble breathing, and he had a positive care sign, which we'll get into more later. So let's start with the anatomy of the thoracic cage. The thoracic cage contains your lungs and all your breathing apparatuses, and the border of the thoracic cage is the diaphragm here. And so the diaphragm borders your abdomen, and up against the diaphragm, you have your liver and your spleen and a little bit of your stomach. And so when the diaphragm contracts and pushes all of these abdominal organs down, it puts pressure on them. And so if there is an issue with any of these abdominal organs, then the diaphragm would have trouble contracting and putting pressure on these organs because they would be inflamed and too big to compress. Also, the ribs in the left upper quadrant, you would have like ribs 7 through 10, if you can see on this diagram here. Those are also some relevant anatomy that we should be looking at if he has pain in his left upper quadrant here. All of those ribs guard the organs that we talked about before. So the first potential diagnosis is a rib fracture. The rib fracture can explain shortness of breath. Um, your ribs expand upon inhalation, and if your ribs were injured, they would not do that, which would cause some pain when you tried to. Um, the rib fracture will also explain abdominal pain, as broken bones can be very painful, and falling off of an ATV is certainly enough trauma to break a rib. However, I do not think that this is his true diagnosis because his radiograph or X-ray came back normal, and I have that picture here, and all of his ribs look very much intact. Next, we have the anatomy of the retroperitoneal space. The retroperitoneal space is the space posterior to the peritoneum. It's deep to the diaphragm and it contains the kidneys. The kidneys are on either side of the spinal cord here, and anterior to the spinal cord here is, the spine here is the abdominal aorta and the inferior vena cava. Those, it's most of it's labeled, but those little triangles above the kidneys are the adrenal glands, and above the aorta, that little slimy, bulby looking organ is the pancreas. All of these are enclosed in the retroperitoneal space. So there's lots of important circulatory structures in the retroperitoneal space, which is why it'll be important to make sure that the patient does not have any problems involving the retroperitoneal space. And it is very possible with the pain that he's experiencing. So a potential diagnosis is the retroperitoneal hemorrhage. Retroperitoneal hemorrhage is bleeding in the retroperitoneal space. This can certainly be caused by blunt trauma, such as falling off a four-wheeler, abdominal pain. A patient would experience abdominal pain if they were suffering from retroperitoneal hemorrhage. However, I do not think that this patient is suffering from a retroperitoneal hemorrhage. His pain was in his left upper quadrant when he was suffering from abdominal pain, and most of the time, patients suffering from this experience pain more in their hips and like lumbar area. Also, Collins sign is bruising around the umbilicus, and the patient was negative for that. That could be indicative of a retroperitoneal hemorrhage, and he did not have it. Gray's Turner sign is also indicative of a retroperitoneal hemorrhage, which is bruising around or above the hips, and he did not have that either. So I do not think this was his diagnosis. Next, we have the spleen. So the spleen is an organ located in our left upper quadrant. It functions to filter our blood. It lets young, healthy, like flexible erythrocytes through, but it has a system that catches the older, bigger, sometimes deformed erythrocytes that need to go. And it has macrophages that phagocytize them and repurpose them, just like everything else in our body does. The spleen helps to prevent infection and also serves as a blood reservoir for when we need it. So the spleen filters blood, so it has to have a pretty good blood supply. So right off the abdominal aorta here is the celiac trunk, and the celiac trunk branches into the splenic artery, which goes straight to the spleen and helps to filter blood. The spleen is right beneath the diaphragm. It's a very soft and squishy organ, so it curves right to the diaphragm, and it also curves and contours right to the inside of the left ribs. So it's right up next to the left ribs, and it's also adjacent to the stomach. Okay, a care sign. This patient tested positive for the care sign, and the care sign is a major indicator of a ruptured spleen. So, this patient complained of pain in his left shoulder above the clavicle when he was lying down. This is a case of referred pain. So, your diaphragm is innervated by the phrenic nerve, and the phrenic nerve runs all the way up through C3 and C5. So when your diaphragm experiences pain, you experience it in your left shoulder because there's not a lot of pain receptors in your abdomen. So when you lie down, if your spleen is ruptured, if you have any sort of blood or other substance in your peritoneal cavity, it'll brush up against your diaphragm and irritate it from the beneath and cause pain. And so you'll feel this pain not in your abdomen, but in your left upper shoulder. So this patient, I believe, is definitely experiencing referred pain. And this is why a positive care sign or pain in the left upper clavicle could indicate a ruptured spleen in your abdomen, which is super cool. So the third and final potential diagnosis for this patient is a ruptured spleen. Ruptured spleens can definitely be caused by blunt trauma. They're very soft and squishy and easy to burst. um, They're located in the left upper quadrant where this patient was experiencing abdominal pain. This patient also had a positive care sign, which is very indicative of a ruptured spleen. Not to mention his CT scan, which I have here, showed hemoperitoneum or blood in the peritoneum. And the spleen is a very, very vascular, very blood filled organ. So if it were ruptured, you would have blood in the hemoperitoneum. Dyspnea or shortness of breath. So when the diaphragm went to contract and compress the spleen, it would not want to because it would be irritated, which could explain his shortness of breath. Also, he was also losing a lot of blood, which would also make you short of breath because you would have low blood pressure and your body would be breathing more oxygen to try and make up for all this blood you're losing. Not to mention the rebound tenderness in the left upper quadrant. So the peritoneum was inflamed because of all the blood that was circulating in it. And so this is very serious. You could die from sepsis, or like you could bleed out internally, um, because it's very vascular and this head needs to be fixed. So there's lots of things you can do. The first one, if it's very, very mild, like if it's not a large leak, I guess you could say, they might just put you on observation. So they might just observe you for a few days, make sure that it is healing by itself. For a more serious injury, a surgeon can go in and repair the spleen. So they could use stitches or any other surgical method to just close up that hole or leak or rupture of any sort to keep that blood where it's supposed to be. Again, even more serious, you could go for a partial splenectomy. So they could remove the damaged part of the spleen and keep the healthy part so that the spleen maintains its function. However, if the spleen is not at all savable, the surgeon would have to perform a splenectomy, which is the removal of the entire spleen. And that is my case study. Here are where I got all the images, and here is where I got most of my information.